This is the continuum of our mental health levels of care. This is the step ladder. You start off on the left with outpatient. If outpatient isn't enough, then we would progress to an intensive outpatient program. If that isn't enough, we could move a student to partial hospitalization program. If they need even more support, we can move to residential treatment. And then the highest level of support is inpatient hospitalization. So it's not linear. We can start at outpatient therapy and we can jump to PHP. We can move from PHP down to IOP. There's a lot of different variables that exist within this continuum. First, I want to talk about outpatient therapy. This is what most people think of when we think about therapy in its traditional sense. For the most part, we're thinking about weekly 50-minute sessions with a social worker, counselor, psychologist, someone who's providing mental health support, focusing on coping skills and support. In this environment, the individual is still maintaining independent living at home. They are still able to attend school, attend work. This is ideal for our mild to moderate needs, and this is our least intensive level of care. And I also want to take a second and just name that this is an outpatient therapy does not only refer to one-on-one weekly 50-minute sessions. This is also where we would find some of the group counseling offerings or some of the family therapy counseling offerings that are available to our community. The next program that we have on the Step Up is an intensive outpatient program, often referred to as an IOP. They vary quite a bit from program to program, but in essence, they are all part-time. They are all 3 to 5 days per week. Many of them are 3 to 4 hours per day. It does provide a higher level of structure. Your child would be involved in group counseling. They would be involved in a number of different kinds of counseling activities as part of the IOP that would expose them to different coping skills and strategies that they would be able to use when they step down out of IOP. The important thing to recognize about IOP programs is some normal routines may still persist. So for example, there are many students that attend an IOP and also continue to attend school part-time. For an IOP, we're really going to be focusing on stabilization and skill building in order to step that individual back to where outpatient therapy is an appropriate level of care. The next place we would look to is a partial hospitalization program. And this is a little bit of a misnomer because many of these programs do not take place inside of a hospital. And so I want to name that because sometimes the name can be a little frightening here. Partial hospitalization program, otherwise known as PHP, often are 5 days a week. They are significantly longer in time, 4 to 6. I've even seen longer than that hours per day. Your student is going to be receiving hospital level clinical intensity. By that, I mean group counseling, individual counseling. There most likely will be psychiatry assessments. There's going to be a family therapy piece. There's going to be a real clinical intensity that is stepped up to support your student and your family. However, there are no overnight stays. In that a PHP or a partial hospitalization program, your child would be in the program 5 days per week, multiple hours per day, basically like a full-time position. However, they are going to be returning back home after the program is over and will be staying with you in the evenings to then return to the program in the morning. Students and children in PHP programs, the focus is on, again, stabilization, safety, structure, increasing that coping capacity before returning to school or stepping down to IOP. If your student is in a partial hospitalization program and we are not seeing the results, there's an additional level of support. There is residential, which is very similar to PHP. However, the main difference, and it is a significant difference, is that in residential, your student lives on site for a set period, typically as short as 4 weeks, as long as 12 weeks. This is where staff are present around the clock, lots of different practitioners to provide structure, safety, and consistency. There are residential programs that are housed within hospitals, but there's also many residential programs that are set up to feel more like dormitories and less like hospitals. That's just something to think about if your family is having the residential conversation.